Her left leg and foot now weigh 87 pounds.
It's painful. I can't take steps without being in pain. You know, when I see people walking with their kids at a fast pace, it's just like, damn, why? You know, why me?
Vicky needs help from her 8-year-old daughter, Breezy, to find new clothes to fit over her increasingly swelling leg.
This?
Nah.
Yeah, you're right.
Something nice and sexy and... How about over there? But as you see, this won't even cover one side. I think I've missed out a lot on what I can wear, you know, and what I can't wear, and how good I could have looked in my 30s, you know, strutting around in jeans and looking good and everything, but nobody ever prepared me for this. Nobody prepared me for having, like, this gargantuan leg. I can't even get the tip of the shoe on my foot. And these are wide width.
Okay, now...
So that upsets me because it's hard for me to even get sandals.
That foot's a little bit chubby.
I know, but it's still, I can't get into them, Breezy.
Why would you wear these?
Yeah.
And they're pretty.
Yeah, I would wear all those.
If they had those in kid size, I would buy them with my own money.
What size do you take?
11. See, these won't even fit today because of my foot. But this is like the only thing I can get that I can wear. You know, I can walk around with them. But right now, because my toes are swollen, they won't close right. But I don't get to look for pretty ones. I don't get to look for nice ones. I don't get to look for ones that zip up or boots or any of that. Men's shoes, size 11. That's what I get. Hi. How are you doing?
After shopping, Vicky meets up with her mother to discuss her increasing depression about her condition.
Good you could come out today so we could see each other?
Yeah, I think it's wonderful because I need to talk to you about what's going on.
Vicky's legs are not very different in this picture. There's just a little slight bit of difference here. Because it was when you weren't that old, but when you got a little older, as you got older, it got bigger and bigger and bigger.
Vicky's leg has been gradually growing since she was a child. She was a very active teenager and lived a normal life despite her leg swelling as she got older. Vicky and her mother are convinced her condition was triggered by a dresser falling on her foot when she was 2.
One day I heard a big noise and I came in and your little baby shift robe dresser was on top of you. You didn't seem to be hurt too much, but you know, maybe a week or so later, I just couldn't put your shoe on. And I noticed that there was a swelling. I think something happened when the dresser fell on you. It brought it on somehow. In my wildest dreams, I never thought it would get like it is now. And I prayed for 46 years that we could do something about it. Well, even today, when I look at your leg, when I look at pictures, it makes me cry because I can't do anything about it personally. It troubles me when I look at it, even now.
It troubles me when I look at it. It's terrible. It's a terrible feeling.
After talking with her mother, Vicky knows she has to find treatment for her condition.
It's got to happen. It really has to happen. I mean, it has to happen. I'm not going to go without walking.
Over a period of 40 years, Vicky's lymphedema has been growing through a lack of medical insurance and fear of the unknown.
You know, people tell me, oh, just cut your whole leg off, you know, and that's not going to solve it. I can feel my toes, I can feel my leg. The infections are horrendous, but afterwards I still have a leg. My leg works.
Vicky is starting in-depth research for treatment. First, she drops her daughter Breezy at school.
Okay, love, give me a kiss. I love you.
Love you too. Bye-bye.
She's the cutest little run. Here she goes, my little love, my little angel. She's my life. I live for her.
She travels to the local library. She has begun looking for information before, but now she's determined to take action. Vicky researches a variety of treatments that are available to help reduce her lymphedema. Some clinics use a massage technique.
His wrappings and manually squeezing the fluid out of the leg.
She has also discovered an expert in Sweden, pioneering a new technique for treating lymphedema, using liposuction to reduce the swelling.
Oh, it would be a wonderful thing if they could do that for me.
Vicky would like to find out about both the massage technique and the groundbreaking liposuction method. We help Vicky get in touch with plastic surgeon Dr. Brorson in Sweden to hear about the liposuction.
I do general plastic surgery, and I've been focusing on lymphedema, for example, in arms and legs.
Dr. Brorson explains to Vicky that he has successfully operated on 158 lymphedema patients with this technique, working at the Malmö University Hospital.
I don't need to go to the gym, because this is my workout for the week.
Dr. Brorson believes that a faulty lymphatic system leads to the laying down of excess fat in the affected area.
If you remove lymph glands, the lymph vessels cannot transport through the lymph glands. So that is why lymph is accumulated. Now this causes the formation of increase of fat tissue, the stagnation of lymph. But the mechanism doing this is probably inflammation, but that has still to be proven.
Vicky is intrigued by the liposuction route, but wants to examine non-invasive options closer to home, too.
Hi, my name is Vicky Bork, and I've been...
We help her contact a clinic in Florida that she found on the internet.
I really need to do something about it before I'm not able to walk. And like I said, I'm 46, and my daughter's 8, and I want to be able to, do more things with her.
Aww.
Thank you very much for your time. Okay, bye-bye. The conversation was with a doctor that's a specialist. I know.
Vicky has set up an appointment with the Academy of Lymphatic Studies. Because her lymphedema is so extreme, they have agreed to see her without medical insurance. Vicky wants the appointment to be successful, to help her daughter's life as well as her own.
She understands that Mommy has a bad leg and that, we're trying to get something done for her. She's learned a bit about nursing because she's helped me, do my leg, wrapping my leg. But I believe that, I didn't have a child to have her take care of me. With a lot of hope that this therapy will be successful.